Hello there, I'm Dr. Adrian Larson and I'm here to introduce the StimPlus Pro. This is my favorite little tool for handheld electroacupuncture treatment because you can instantly locate a point and then hit a button and treat a point, just like that. So let's get into it and I'll teach you how to use it. Now let's talk about why you would want to use the StimPlus Pro and 3 specific situations when the StimPlus Pro is going to be vastly superior to needles. Now, I have nothing against needles. I use them, I love them, and they're very important. But in some situations, the needle is not the right approach. First of all, point location. This is really vital. When you have a needle, you've got to get it right in the point. Some of those points, though, can be kind of hard to locate. For example, in the ear, the auricular points are very small, they're close together. If you're not exactly certain that you're right on the point that you want to treat, you might miss it completely. But the StimPlus Pro, because it has the electrical point locator built in, it makes it super easy. You'll always know that you're right on the point. There's no guesswork. Whether it's on the ear, on the body, perhaps on a child, you always know where you are, and you always know that you're treating the right thing. Secondly, patient comfort. We've all dealt with those patients that are simply scared of needles. They need to be introduced to acupuncture in a way that's just a little bit less threatening. Or perhaps you're treating pediatrics or elderly, or there's certain points that you won't put a needle in anyway because they're just too sensitive, no matter who you're treating. That's where StimPlus Pro really shines. You can put needles in some points, you can treat the other points electrically with StimPlus Pro and still get phenomenally good results with what you're doing. Last but not least, and this is perhaps one of the greatest features of the StimPlus Pro, is how fast it works. You can get the effect you're looking for in a matter of 15 seconds often with the StimPlus Pro, where you might need 15 minutes with a needle. If you have a busy practice, you need to get a lot done quickly, or perhaps you're in a situation where you just don't have a lot of time, the StimPlus Pro will get you outstanding results very quickly. That's part of why I love it so much and why I use it. So to begin, let's talk about what's in the box when you get your StimPlus Pro instrument. First of all, you have the unit itself. I love it because it's small and handheld and it'll fit right there. You have a carrying case if you're going mobile with it. You'll see that there's a small earphone, and some versions of the earphone actually have a volume control built right into the wire. This is useful if you're in a noisy environment and you can't hear the audio feedback that's made by the StimPlus Pro itself. You can just plug the earphone in, it goes right here on the black side, not on the silver side of the StimPlus Pro. Put it in your ear and you're ready to work. You'll also see that the StimPlus includes a tip. This is a special extended tip that some people find useful for auricular therapy, for example, when you need to get into an area that might need a little more reach. And last but not least, we have the wrist strap. The wrist strap is the one with the coiled, flexible cord. Now the wrist strap is used to do what's called completing the circuit. When you're using the StimPlus Pro, the electrical circuit must be completed from the silver part of the handle to the tip. It takes a measurement between those two, and that's how it locates where the points are. That's also how it provides treatment. If you use the wrist strap, you plug it into the silver part of the StimPlus Pro, put the other end on the patient's wrist, and that way the electricity has a path to go from the tip through the patient to the patient's wrist and then back into the StimPlus Pro return side. However, if you prefer not to use the wrist strap, and I generally don't use it, then you can just go ahead and complete that circuit yourself by making sure that your fingers are touching the silver side of the unit and that your other hand is touching the patient's skin. So for example, if you're treating a patient's ear, if your hand is on the ear and your other hand is on the silver side, then you are completing the circuit with the patient and it works very well. Now I'll show you the controls on the StimPlus Pro unit. Starting at the end that's the furthest away from the tip, you see that we have the on-off switch. That's self-explanatory. We have the treatment timing switch, manual, 15 seconds and 30 seconds. And that controls how long the unit stimulates whenever you push the stimulate button, which is the long blue button on the back of the unit. 15 seconds is a good place to start. The next switch over controls the treatment frequency. That's how many pulses per second the unit provides. Your choices are 5, 10, and 20 pulses per second, or hertz. If you don't know, then leave it at 10 hertz. That's a good place to start. And then the next control over, with the plus and minus on it, actually is not a volume control. Some people think it is, but it is the intensity control of the treatment. The more you turn it up, then the more intense the electrical stimulation is that will be provided. Let me show you how that works. I'm going to turn the unit on, and you can hear that it's beeping. That beeping means that it is in search mode. And as I move around, you can hear that pitch change. When the pitch gets higher, or when there are more lights lit up on the back of the device, that means there's higher conductivity, and that means there's an active point there. Similarly, when I'm treating, you'll see that one of the lights is flashing, and as I repeatedly push the plus button, then it moves up the scale for which light is flashing to show that I have increased the intensity of the treatment. If I push the minus button, it moves back down. And repeatedly pushing it is how you move it up and down. Also during treatment, you'll see that the green LED out by the tip flashes. That's the treatment light to show that an active treatment is taking place. When the time of the treatment, in this case I have it for 15 seconds, when that is expired, then it automatically goes back into search mode and you're back ready to locate your next point, and you'll know that because the unit starts beeping again. So those are the controls in a nutshell. Turn it on, you're in search mode, locate the point, push the button, and you're in treatment mode. Let's do a demonstration of how to use the StimPlus Pro unit. We'll take it step by step and make it nice and easy. We'll start by doing an auricular point, and then we'll do a body point. So, first of all, turn the unit on. It should make the beeping sound that indicates that it's in search mode. And then we want to make sure that the circuit is complete. So I'm going to be holding the unit with my fingers touching the silver underside, and my other hand is going to be touching the patient's skin. Once I do that, then I'm ready to search. And as I search, the pitch will change and the number of lights that are lit will change. And there you can see that I found the active point, so I'm ready to treat. I just push the button. Now it's set for 15 seconds, so it's automatically going to provide treatment for 15 seconds. When the treatment time is up, then it's going to go back to search mode, and I'm ready to search for and find the next point. And you can keep going until you've gotten all the points that you wanted to treat. And it's just that simple for treating the ear. Now, for treating a point on the body, it's going to work in very much the same way. You want to make sure that you're completing the circuit. I'm touching the silver part, I'm touching the skin, or I could use the wrist strap. You're going to search for the point. There it is right there. Push the button, and now I'm treating. You can also treat in what's called manual mode. And so the way that looks is I push the button, I'm treating, but as soon as I let go of the button, I'm not treating anymore. That way I can only treat for a second or two, or as long as I want to. Something that needs to be pointed out, searching for points on the ear is going to be different than searching for points on the body, because the ear is more conductive. Searching for points on the body, it won't be nearly as sensitive. Also, the electrical location of the point you're looking for might be different than the anatomical location that you're used to. So for example, if I'm looking for large intestine 4, and the anatomical location I might expect to be somewhere up here, but when I start searching, it's not very active there. It's about a centimeter away, and that's where I find large intestine 4, and it's highly active. Treating at that electrical location will still stimulate the point properly, as the electricity travels exactly where it needs to go. Let's talk about some frequently asked questions. The most common question I get asked about the StimPlus Pro is, which setting should I use? So I tell people, start with 15-second treatment duration and start with 10 Hertz frequency. 10 Hertz is great for points on the body. Some of the ear points I like to turn it down to 5 Hertz because it will be slightly less intense on the stimulation and be more comfortable for your patient. Also, the unit defaults to the lowest intensity setting when you turn it on. Once you're stimulating, you can turn up that intensity setting gradually, just to the level of patient comfort. There's no reason that you want it to be painful or pinchy when you're treating a patient. It is okay though if they feel a small electrical tingle. All right, another question I get is, what are the contraindications? Is it safe to use in certain situations? Well, first of all, because it's an electrical modality, you never want to use it on a patient that has an implanted electrical device like a pacemaker. It's always contraindicated because you don't want to be using electricity in a situation like that. You also don't want to use it on broken skin. If there's a wound, something like that, then you don't want to be using electricity or putting this tip in or near that area. Similarly with cancers, you want to stay away. Don't use the unit transcranially. That means that if I'm treating this ear, I need to make sure that my ground return, that the skin that I'm touching is on the same side of the head, so the electricity is not traveling through the head. We don't want to go transcranially and have electricity affecting the brain. But using it surface-wise on one side or the other, there's no contraindication at all. And then lastly, don't use it inside the mouth, the nose, any body orifices. If you're going to use it near the eye, stay away from the eyeball. It's designed for external use only. Those are really the only contraindications. Other than that, use your professional skills and common sense. It should never be uncomfortable or painful for the patient. I get asked about the batteries for the StimPlus Pro. Well, you can get more batteries at stimpluspro.com on the website. Changing them is really easy. You just take off the little battery door, and I tap it in my hands a couple of times, and there they come right out. They're just little coin cells. Place them back in, and you're ready to go. The batteries on the unit will last a long time. They're lithium cells, they pack a lot of power, and despite its small size, the unit does a great job stimulating. Even from those little tiny batteries, you get good stimulation, and those batteries will last years in some cases. And if you need to have some spare ones, run on over to stimpluspro.com. You can pick them up. Last and not least, people ask, where can I use the StimPlus Pro? Can I use it on this point or on that point? The answer is yes. Aside from the contraindications I already mentioned, you can use it on the ear, you can use it on the body, you can use it on any acupuncture point that you would normally use a needle on, and you could expect great results. So enjoy your StimPlus Pro. Don't hesitate to contact us if you have questions, and I wish you much success in your practice.